So the first thing that I would like to talk about the scapula, or to say about the scapula or the shoulder blade, is that you have two, one on the left and one on the right side. Also that this is a flat, as you can see, flat bone and roughly triangular. And another thing that you need to know is this is located on the posterolateral aspect of the thoracic cage, as you can see here. So it's located just behind the ribs. And I will show you the entire skeleton so you can see how these two bones fit in the entire skeleton. So if we go to the posterior side, you find the two scapulas right here, the two shoulder blades. What I will do now is I'm going to talk about the structures of the scapula, but I'm not going to go into detail, so bear with me, because there are a lot of ligaments and muscles that you need to understand that bind to or attach to the scapula, to the structures that I'm going to mention now. But I just want to give you the names so later on you can understand what I'm talking about. So looking at the anterior side of the scapula, as you can see here, we're looking to the front, so looking at the front of the scapula. And I'm going to isolate it here and zoom it. And you can see here two processes that are very important. One on the posterior side, this is called the acromion process. This process here, and then located on the anterior side of the scapula, you find another very important process. This is the coracoid process. Now, another important structure to know here is this cavity. This is called the glenoid cavity, and there is a tubercle here on the superior part of the glenoid cavity, and it's a supraglenoid tubercle. On the inferior side, you should find another tubercle here. This is called the infraglenoid tubercle. Now, if we move to the still on the anterior side of the scapula, but moving a little bit to the right, you will find here a notch, as you can see here. This notch is called the suprascapular notch. This is the suprascapular notch. Now, another important thing to know is this bottom angle here is called the inferior angle of the scapula. This area here is called the superior angle, and this here is called the medial angle of the scapula. Now, this broad concavity here that I will try to show you, clear this out, you can see a concavity here. This concavity is called the subscapular fossa. So what we're going to do now is we're going to look at the posterior side of the scapula. So you can see the structures very well. And you can still see here this process. I'm going to highlight it for you. This process here is the acromion process. Now, another structure that you see on the posterior side of the scapula is the spine of the scapula. And this is the spine of the scapula. On the superior side of the spine of the scapula, I'm going to try to rotate a little bit. Here on the superior side, you will see this fossa, and this fossa here is called the supraspinous fossa. Rotating again to the inferior side of the spine, you see another fossa, and this is called the infraspinous fossa. Another thing that I would like to show you here is a notch that you find right here. This notch here, this is a notch connecting the supra and the infraspinous fossae. So it connects the two fossae. Another structure that you need to know here is this. Let me rotate a little bit. As you can see here, there is an angle here forming in the acromion process, and this is called, highlighting here, this is called the acromion or acromial angle. Another thing that you need to know, still see it here, and I mentioned on the anterior side when you talked about the anterior side, is that you still have a superior angle and here an inferior angle, and of course the medial angle. So now I need to tell you that there are three borders of the scapula that you need to know. And to do so, I'm going to use the interior part of the front side of the scapula to show these three borders. As you can see here, I'm zooming in and clearing out the skeleton. So this is the front part of the scapula, the one that is on top of the ribs. And there are three borders that you need to know. The first one is the superior border. And the superior border is the shortest and the thinnest, and it goes from the medial angle all the way to the base of the coracoid process. Now, the lateral border is the thickest of the three, and it begins above at the lower margin of the glenoid cavity and goes all the way to the inferior angle. Now, the medial border is the longest of the three and extends from the medial angle all the way to the inferior angle. So again, you have the superior border, the lateral border, and the medial border. So what I want to do now is show you the articulations of the scapula, so which bones or which structures articulate with the scapula. The first one, and a very evident articulation here that you can see, you have the clavicle here articulating with the acromion of the scapula. So the acromial side of the clavicle will articulate. Let me go back and show you here. So the acromial side of the clavicle is articulating with the acromion of the scapula right here. Another articulation that is happening here in the scapula is with the head of the humerus right here. This is the head of the humerus, and is articulating with the glenoid cavity of the scapula. And again, I'm going to clear this out so you can see it three-dimensionally. As you can see, there is an articulation here with the head of the humerus and the glenoid cavity of the scapula. These are the two main articulations of the scapula.